I think that we have different needs associated with the different disease stages in MDS. In early disease stage, we know that severe transfusion-dependent anemia is the most relevant prognostic factor for all the patients. So in this patient population, the unmet need is to try to improve anemia by using different kind of drugs that should be implemented within clinical trials, while for high-risk patient population, the unmet need is to try to delay the leukemia transformation and by this way to improve the patient survival. The treatment of high-risk patients with MDS is a challenge in clinical practice because we have only limited treatment opportunities. So I think that we have to perform innovative clinical trials, maybe in a subset of patients with homogeneous biological characteristics in order to check for innovative treatment opportunities.